Hey, CEimpact subscribers, welcome to the Game Changers Clinical Conversations podcast. I'm your host, Josh Kinsey, and as always, I'm excited about our conversation today. As a reminder, we've launched a special pilot series in collaboration with our friends at Pyrls, a modern drug information resource and app. These crossover episodes, called GameChanging Pyrls, combine Pyrls' trusted evidence-based clinical tools with CEimpact's expertise in pharmacy education and accreditation, bringing you timely, actionable content that supports both your practice and your professional development. It's a privilege to work alongside the Pyrls team, and we're excited to continue this pilot series with today's episode focused on HIV treatment. HIV treatment continues to evolve, offering simpler regimens, improved tolerability, and life-changing outcomes for patients. In today's episode, we'll cover what pharmacists need to know about current antiretroviral therapy, key counseling points, and how to support patients through every step of their treatment journey. And it's so great to have Rachel Maynard back as our guest for today's episode. Rachel, welcome.
Thank you so much for having me back.
Yeah, and as a reminder, Rachel joined us for a previous episode on asthma, but for some of those listeners that may not have had a chance to listen to that, Rachel, if you'll take just a minute or two to introduce yourself and tell us a little bit about your position at Pyrls and anything else you want to share.
Sure. Yeah. Thanks, Josh. So I am a clinical lead at Pyrls. As you mentioned, we're a drug information resource, and some of our most popular features are some of our charts and key counseling points in clinical Pyrls. So the name is apt. But my prior background, I worked for over a decade in the drug information education space. And before that, I was a community pharmacist. I did a community pharmacy residency, and then was a staff pharmacist and managed clinical programs for a region of a grocery store chain. So really, I'm here and excited today, passionate about educating healthcare providers to optimize care for patients in the best way possible, using tools and resources to make their work efficient and effective. So very, very happy to be here and to be chatting about this very important topic.
Yeah, absolutely. And, like I said in the segue, this is this topic, I feel like it's one of the ones that is just ever changing, like new stuff all the time, new, different regimens, and which is great. It's just wonderful, but it's one of those that we really have to work hard at keeping up to date with. So thank you so much for joining us and giving us some actionable insights for today. So as I always like to do, start off the episode with just a foundational refresh to make sure everybody's on the same page. So if you don't mind, let's just recap exactly what HIV is and just a little, maybe some facts about it and so forth. So we'll start with that.
Sure. So yeah, HIV, it stands for human immunodeficiency virus. It is a retrovirus that targets the immune system. And so some of the metrics you might hear around that are CD4 count, which is a type of white blood cell, and also viral load. So how much virus is essentially in the blood for patients to know how well their condition is being managed. But ultimately it can lead to, if unmanaged, can lead to a weakening of the immune system. And the most advanced stage of an HIV infection would be AIDS, acquired immunodeficiency syndrome. So without treatment, the life expectancy for people with AIDS is actually about 3 years, and even less if they were to develop an opportunistic infection. So if you think about that life expectancy for AIDS versus where we are now in treating HIV and getting patients treated sooner and managing the condition, like you say, it's come a really long way in the 40 years or so since it was sort of at the height of the epidemic. Yeah,
absolutely. And, again, reiterating that this is no longer not to be frank, but no longer a death sentence, right? Like
absolutely.
It's a manageable condition. Early diagnosis is key. Also making sure that the right regimen and treatment is key. But yeah, totally manageable disease, and patients can live a normal, healthy life.
What we're seeing is that, more guidelines are coming out. We have our guidelines focused on HIV treatment, but we're also seeing more guidelines focused on managing chronic comorbidities in people living with HIV, because their life expectancy is now as good as somebody who doesn't have HIV. So,
Yep.
yeah, more like cardiovascular management and guidelines tailored to patients with HIV, but, focusing on these other comorbidities that they might be living with, just like any other patient who's living a long life would expect to have.
Exactly. Yeah. Because, back in the 80s when we, was at the forefront of everything, those patients weren't living long enough to develop diabetes or heart
Right.
disease or things like that. So yeah, it's a great point. So one of the things that we're going to talk about, obviously, is the therapy and the different regimens. And so I mentioned earlier, it's antiretroviral therapy, which we'll just refer to throughout as ART. We talked about that's a mouthful, so we're gonna go ahead and just say that we're gonna just refer to that as ART throughout the rest of the episode today. But let's talk just briefly about what are some of those regimens, and I'd also like to introduce, undetectable. That's something that you're going to hear in treatment, and maybe exactly if you can explain what that means and what we're trying to reach with that.
Yeah, so antiretroviral therapy, ART, since that is a mouthful, that is the idea of using multiple drugs to suppress HIV replication. And that was really sort of, as you say, brought about in the early 90s and sort of revolutionized the treatment of HIV. The idea being that we have a multi-drug regimen that targets various points of the HIV life cycle to help manage the condition. And so one of the key goals of therapy is not only to protect and preserve the immune system, but also through that viral suppression, but also to help prevent transmission to people who don't have HIV. So as you said, this undetectable, and a really easy way to remember this, and what I think is getting a lot of press recently, is this U equals U. So U, the letter U, equals U. So undetectable equals untransmittable. Mm. And the idea that this sustained viral suppression can help prevent sexual transmission of HIV. So again, a really sort of revolutionizing opportunity for people to understand that taking HIV antiretroviral therapy, it doesn't mean just helping their own condition, but also helps prevent transmission to others. And that's a really, I think, powerful point for people to understand.
Absolutely. Absolutely. And it's important for us as pharmacists to understand the terminology that's associated with it. And, if our patients mention something like that, we need to be in the know as to what everything means. So with that, perfect introduction to what is the role of the pharmacist. So where are some of the things that, some of the opportunities that we have, and we're going to dig into those deeper, but obviously we're the medication experts, right? So we are the ones that should know everything about the regimens, the medications, helping to select those if we're working in a collaborative effort with other providers of our patients with HIV. We can obviously help with adherence support. We can help with counseling and all of those sorts of things, and then managing any side effects. So unfortunately, ARTs don't come with no side effects. Just like any other medications, there are a lot of side effects there. And one of the things that I really want to touch on later is, these medications are somewhat highly interactive with other meds and with other things. So we want to be sure that we as pharmacists are in the know about that as well. Anything to add there before we jump into each of those kind of individually and greater?
Yeah, there's a lot to tackle. So yeah, let's break that up into bite-sized chunks.
Perfect. Okay. So one of the first things as an opportunity for pharmacists, let's talk about the guidelines, the guideline-based care, the pharmacotherapy that's out there, and the importance of ensuring that our patients are on the right therapy first line, so that we're not running out of options, or that they're not reaching undetectable status quickly, which they should.
Yep. So the guidelines are from the U.S. Department of Health and Human Services, and the website is clinicalinfo.hiv.gov. So it's very easy to find. And again, there are guidelines specifically for antiretroviral therapy for adults and adolescents, as well as more tailored guidelines for perinatal care, for pediatric patients, for opportunistic infections. So there's a whole host of guidelines on the website, but very easy to digest and read through. And they have, executive summaries and very easy to sort of get the information you need quickly. So it's a good resource to be aware of. And those are updated on a rolling basis as new evidence comes out. So the last time these guidelines were updated was last September. And there was a pretty big shift in sort of this initial treatment for HIV, because one of the previous regimens that was recommended as initial treatment was sort of swapped out with a different regimen. And so I can chat a little bit about that if we're at a good place to do that. Or
let's do it.
Okay,
no, that's perfect.
Okay, sure. So basically, you can sort of think of the treatment of HIV as typically requiring 2 or 3 drugs in the regimen. So typically, we'll see 2 nucleoside reverse transcriptase inhibitors, NRTIs, plus a third drug from one of these other classes, which might be an integrase strand transfer inhibitor, an integrase inhibitor, I'll call it, an NNRTI, non-nucleoside reverse transcriptase inhibitor, or a protease inhibitor with a pharmacokinetic booster. So I know that's a lot. And I know for me, learning about HIV in school and then like trying to remember, it was always very overwhelming. But there are, like I said, lots of resources to help. The guidelines are great. At Pyrls, we also have a pharmacotherapy review cheat sheet, which outlines the first line regimens for many patients with HIV. And I know you're showing that here, Josh. So what we see now is that initial ART for most people living with HIV is, as you said, very streamlined and straightforward compared to what it was even a few years ago. So one of the first line options is a complete regimen. That's 1 tablet taken once daily with or without food, very straightforward. So it has 3 drugs. It has bictegravir, tenofovir, alafenamide, and emtricitabine. So again, an integrase inhibitor with 2 NRTIs. So matches up with that sort of general a combination we need to be thinking about. But it's a very simplified regimen for patients. So that's one option. There are other 3 drug combos that, again, the chart shows and the guidelines have. But basically it means that for most people, they can have a 2-pill regimen, and much easier for 2-pill, starting out at the most, and sometimes just 1. So again, very, very streamlined. And the side effects you mentioned can be problematic, but for these initial therapies, the toxicity and side effect concern is actually much, much less than it was with our older regimens. So again, that's another long way that I think we've come with HIV treatment, is not only the simplicity, but also helping to mitigate some of those side effects a bit with some of the newer regimens.
And have a better quality of life for the patient as they're taking the medications.
And to help improve adherence, right? Because we know
Absolutely.
adherence, as you said, is such an important part of HIV treatment. So if we can have meds that are better tolerated, that's obviously going to innately improve adherence just by the matter of having better tolerated meds.
Yep. Yeah. And this chart, for those of you that are just listening, I am showing a chart right now from Pyrls, and it is their pharmacotherapy review, HIV pharmacotherapy review chart. And I was telling Rachel earlier, it's so good. It's so detailed. It has so much great information on here. And it's just a really great resource for the pharmacy teams to ensure that patients are starting out on the right thing. And if there is an opportunity for, if they have to change therapy, this is a great resource to look at to see what are the other options for your patients. Rachel, is there anything else you wanted to share on this particular chart here?
No, I would just say, again, I always felt like HIV treatment was very overwhelming. And I think this just helps to exemplify the fact that it doesn't need to be. And for all of us as pharmacists, I think we can really just sort of remember some simple strategies, like the fact that, it's 2 NRTIs usually with one of these other classes. And there are these complete regimens available that have all 3 drugs in 1 pill. So we have, again, it's streamlined and simplified, hopefully, from what many of us may have, been taught in school.
Yeah, exactly. I mean, it was 20 years ago for me when I was in school, more than 20. So it definitely is much more streamlined, and I feel like much more manageable from that provider perspective. Like, it's easier for us as pharmacists to help manage this process. So you mentioned adherence. support. And I think that's huge. So let's talk about that. That's another opportunity. Obviously, as pharmacists, we're the medication experts, but we also, that's one of our roles, is making sure that patients understand the importance of staying adherent. So if we can speak to that for just a couple minutes as well.
Yeah, absolutely. And I think just like with any adherence consideration in working with our patients, it's not a one size fits all approach, and any concerns about adherence are going to be very patient specific. So finding out what might be a potential barrier for that patient, or where a gap in understanding might be, and helping the patient get that buy-in for whatever is important to them. So, if it is a concern about number of pills, number of daily doses, as I said, there are one pill, one daily dose, with or without food, that can be very straightforward. So, hopefully that is less of a concern than it maybe was before. But also, helping people understand the importance of taking the medicine in this condition versus other conditions they might be taking medicines for. It's a similar sort of thing where they might not have any symptoms or any visible, effects from the condition, just like with heart disease, diabetes, they might not have anything that they feel, but the importance of suppressing that viral load and maintaining that in order to not only improve their own health, but also that U equals U, right? So preventing transmission to others. And especially with HIV treatment, the concern about resistance. And so helping them understand if the regimen isn't taken as prescribed, then it might increase the risk of resistance. And then that can lead to the treatment not working as well. And then they might need a different regimen that maybe isn't as easy to take or isn't tolerated as well. And so again, getting that understanding and buy-in early on, I think can just go a long way, but really helping them understand, working with the patient, as I say, if it's concerned about side effects, again, side effects are much more, easily navigated than they might have been in the past. With any regimen, it's going to vary by regimen, and there are still a lot of regimens, so it's going to vary, but we can let them know that, common side effects include things like fatigue, nausea, sleep problems, but those typically are mild and go away with time. I think in terms of side effects, the point I would really want to bring home is that if they are having anything they feel is a side effect, just be sure to report it to me. Like, I would rather have you come to me and tell me that you're concerned, rather than having you try to adjust your regimen or stop the regimen because of those issues with resistance, and then not having that viral load suppressed. So just encouraging that open communication so patients feel comfortable coming to us with those concerns.
Absolutely. And that's something that we talk about all the time as pharmacists. That's our role, is to have that relationship with the patient so that they do feel comfortable telling us everything. I think it's really important too to point out that not only is this like a one pill wonder where, all three are in one pill, but it's just once daily as well. Like it's one pill once daily, taken the same time each day, and so I think that's really important too. I think you think about, and even again, back when I was in school, I felt like the regimens weren't that simplified. Like there was even, multiple times a day or 2 or 3 pills a day or whatever. And so I, just really focusing on, this is simple, this is easy. And if you take it this way and continue to do it in this easy way, then it gets to stay that way. Like it's when you
exactly.
when you're non-adherent, that's when we have more complex regimens. That's when we have difficulties and whatever. So
And I will say too, there is an injectable treatment option as well. So for people who are stable and have a very good viral suppression, there is an injectable option that once it's initiated, it can be given every 2 months or so. So that is another option. If patients are stable and doing well, it may be a consideration for them if they're having trouble with that daily dosing. That could be another injectable option to consider.
Yeah, no, that's a great call out. Again, just so many advancements in this space. The fact that there are injectable options now that are longer acting. So, so one of the other things that we'd be remiss if we didn't talk about is counseling and educating the patients on prevention of transmission. Even though we reached the undetectable, it's not 100% absolutely not possible. It is very, very high. But we want to be sure that we are educating our patients with HIV about, their partners who might be at risk of transmission. So anything you want to add to that in that space?
Yeah. So as you said, pre-exposure prophylaxis, so PrEP, is I think a term that both the public and healthcare professionals are getting more and more aware of. Helping prevent people from being at risk of getting HIV before they're exposed. So like you say, if somebody living with HIV is being treated with antiretroviral therapy and has a partner who doesn't have HIV, if they were to use PrEP, that also would then substantially reduce their risk of getting HIV. And so there are oral medicines, again, that people can take on a daily basis to help prevent exposure. But actually, pretty big news just last week. I don't know if you saw, but there was a new injectable option approved for PrEP. So lenacapavir is the name of the drug. And it's the first option that's actually injected every 6 months for PrEP. So just twice a year, patients can get an injection for PrEP and to help prevent exposure. There was an injectable option before that was given every 2 months. It's still available. And there are still, like I say, oral medications that can be taken as well. But this is another, again, nice option to help simplify PrEP too. And use that in tandem.
And I wonder, is it good news down the line that there may be another long-acting injectable option to treat HIV that is more of a 6 month or 1 year or something like that, which would just make, the regimen that much simpler for patients, just like a one-time dosing. Like that's just, it's interesting to think about, and hopefully that is something that we can see coming down the pipe. So I don't know.
Yeah, if actually the Pyrls chart that we have, that HIV medications chart that we have, so it has, like we said, it has all of the complete regimens. It has the individual drug classes, so you can see which drugs are in each class. It does note the injectable options here as well. There we go. Just waiting for that to pull up. And so, if you scroll down just a little bit, there's, it shows here these lenacapavir options. So that Sunlenca is also approved for treatment, and Yeztugo, is the brand names for these drugs that are for PrEP. So there's both an injectable option of that same drug for treatment as well. So just again, it's not a complete regimen, but it is a drug option that can be injected. Whereas if you look in the complete regimen category, there's, again, oral, but also that injectable that I mentioned, that can be a treatment option too. So just a good way to just sort of have these all side by side. Because again, there are a lot of drugs. It's hard to keep them straight, but definitely lots of options available for patients too, which is great.
Yeah, I know this is another great chart. I love that it's just so well organized, and even the icons here let you know whether it's an oral pill or an injectable. And so, just super great chart. So again, for those of you that are just listening, I'm showing the HIV medications chart, a resource from Pyrls. So, okay, so one other thing, I think that may be all of the opportunities that we wanted to touch on for pharmacists. So let's move into some of those challenges that we see, some of those challenges that we may face as pharmacists with managing the care for our patients. And we've touched on these and we've talked about them, but just to kind of reiterate. So let's dig into the drug interactions first. So unfortunately, some of these medications do have interactions with other medications and so forth. So let's talk a little bit about what that looks like, and being sure that that's something that we as pharmacists are helping out with.
Yeah, and as you say, it is something that it's a common concern with several of these different drug classes, and it's also a concern with products that people may take over the counter, which I think is the trickier part with that. That often people may not think about OTCs or vitamins or supplements as being necessarily a concern with interactions. And so they might know, I need to be aware of interactions, but might not think about OTCs and vitamins as an issue. So I think, again, that I would say is probably one of the most important points, is not only making the person aware that interactions are something they should be talking about each time they start a new product, but also that it's not just prescriptions. It's also the stuff they can get over the counter without talking to anyone if they wanted to. So, Yeah, the ones that I think of most often are those that can affect absorption. And so with
Mm-hmm.
the integrase inhibitors, again, which are often in several of these first line regimens, they can they can interact with divalent cations. So things like iron, calcium, aluminum, magnesium. So again, you can find those in antacids and vitamins and laxatives. So those can usually be managed by spacing apart, but how you space it depends on the drug. So it is just important to have the person be aware of that and coming to you like, hey, if I'm having heartburn, I want to take this antacid, just check with me so that you know how to take it properly with your other meds. Acid reducers more broadly, so not only antacids, but also H2 blockers and PPIs. Again, these over-the-counter meds that may interact are a concern with some other HIV medicines, like atazanavir and rilpivirine. So, just being aware of those. And then those cytochrome P450 interactions too. So CYP enzymes can metabolize many drugs, including various classes of HIV meds. So protease inhibitors tend to be a concern with those. So, for example, with statins, that's something to be aware of. Some of these boosters, pharmacokinetic boosters, like ritonavir and capisostat, I think a lot of us think of ritonavir as sort of like a classic, also in the COVID antiviral, right? And so often something that we think about with interactions. So yeah, definitely some key concerns to be aware of. But I think, again, one of the points I want to drill home with patients is the fact that it's not just prescription medicine. So it's not only important for me to be aware of what you're getting from other pharmacies, but also what you're taking over the counter.
Absolutely. And, Rachel, I think that goes back to the point we made earlier, where building that relationship with the patient, making sure that they feel comfortable talking to us about, everything. And it's important to also say, like you mentioned, tell me things that you're taking over the counter, and if they're taking supplements and things like that, sometimes patients are hesitant to share that because, it's not something that's, like, oh, I read this or I heard this on TV and I'm taking this, as a supplement. And I know you may not agree with it and whatever. So I think it's really important for pharmacists to also be sure that we're in a non-judgmental space and that we're not just saying like, oh, don't do that, don't ever do that or whatever, because that could push the patient away from telling us more. So we want to be sure that we're always keeping the lines of communication open so that they feel comfortable telling us about it, because that's just really important. Because if they start taking things and hiding it from us, then we don't know what they're doing and what they're on, and we can't help manage. So yeah, really important. So another challenge that we have, obviously we touched on it, is, regardless of adherent, I mean, it's pretty clear if the patient is adherent, but there are times when treatments fail and when resistance occurs. And so that is another challenge for us as well, is recognizing when the regimen needs to change or what alternative needs to be had, and also being able to collaborate with other providers in that space to choose different regimens. So if you can kind of talk briefly about that and our role as pharmacists in that space too.
Yeah. And I think it goes back to this idea of, they are checking in with us often on a regular basis. And so making sure they are having regular monitoring with their other healthcare providers if needed. The frequency of how often that happens varies depending on their status, but usually at least 3 to 6 months, they should be having a check of their viral load and making sure, if it is suppressed or not. And helping them understand what that means again. So they might be aware of the need for viral suppression. There are cases where, sometimes there will be a little blip, which is where a patient, they might go up to a detectable viral load and then go back down to an undetectable level without, there could be all kinds of reasons for that to happen. But that doesn't necessarily mean that they've failed or that they're, it doesn't mean that the treatment is failing either. Sometimes that can happen. The blips are different than a virologic failure. So, but seeing some of those results and understanding them also, I think, can go a long way in helping patients understand how that ties back in with adherence, and maybe interactions are leading to some of those issues too, or like you say, it could be a concern with the resistance. So just helping them keep up with that monitoring, understanding what those levels mean, and taking action if needed. But again, it doesn't necessarily mean a change is needed unless they have a consistent viral load over 200. That's typically linked to resistance. And then in that case, identifying the cause. And again, the cause is usually poor adherence is
Right.
critical to then identify whether a new regimen is needed. And if so, if adherence is a concern, being sure to keep that definitely in mind and simplifying the regimen if possible.
Yeah. So Rachel, in our last couple of minutes, I just want to be sure, I think we'd be remiss if we didn't mention, the stigma that sometimes is associated with an HIV status. And also the fact, making sure that we are navigating those sensitive conversations, that we're obviously ensuring confidentiality. But cultural competence is huge as well. We know that certain communities, LGBTQ communities specifically, is more susceptible to HIV infection. And so just understanding that a lot of times there's conversations that will need to be had that, that patient may not be out to their work or to their community or to their family or whatever. And so just really understanding the need for confidentiality and navigating those sensitive discussions. So if there's anything you want to add to that, I know that that's a challenge, but it's also a great opportunity for pharmacists because, we can navigate those situations very easily. And that's something that we can do well. So.
Yeah, I think it goes back to that idea of open communication, creating a safe space. So identifying if you need to go to a more private area,
Sure.
if there's more sensitive conversation that needs to be had, using terms like your medicine instead of your HIV medicine,
Sure.
things like that can be
Yep.
very small steps that can go a long way in helping to avoid stigma. But like you say, just I think it's what we want to do with all of our patients, right? It's just making sure they feel comfortable and using our strategies like active listening and avoid assuming, what their priorities might be. If they have concerns, acknowledging those and recognizing those. And the supplement example you gave is a great example because we wouldn't want them to feel like we would be judging them for taking a supplement. So, making sure that safe space is there, both in a, communication perspective, but also from, an interaction perspective and just chatting with them. So not only privacy from hearing other people being able to hear, but just making them feel comfortable and supporting their decision-making too. So if they do or don't feel comfortable with one strategy or another, supporting them down that road.
Yep. No, it's a great point. So I think we always run out of time, Rachel. We have so much to talk about. So I think just as kind of a wrap up, so many opportunities for pharmacists in this space to help with adherence and educating the patients and ensuring, that we're watching out for any sort of interactions or managing side effects, and just really keeping the lines of communication open with our patients who have HIV. And, the resources that we've shared, so good, that help with pharmacotherapy. They help identify the different medications and the opportunities that are there for regimens. What else do you want to add before we wrap up? Anything that you felt like you didn't get to talk about?
Well, I would just say, something that was always in the back of my mind as a community pharmacist was about vaccination. So I'll just put in a plug for that as well.
Great.
Immunizations
It's great, Rachel.
are always a top of mind for all of our patients, but for patients with HIV, it's also a consideration, not only with what they may need, but also, depending on how well the condition's being managed, if they may not be eligible for some live vaccines, for example. So I'll throw that in as another, thing to be keeping in mind with these discussions. But yeah, I think one of the biggest things that I would take away from the discussion is that U equals U concept. I think that's, there's a lot of information on the CDC site regarding this. And I think it's a new concept that some of us might not be as familiar with, but it is such an important way to help convey the importance of adherence and help patients sort of, get empowered with what they can do to prevent transmission to others.
Yeah, that's great. And to improve their own quality of life.
Exactly.
And so forth. Yeah, that's great. Okay, so as I always do, I think you kind of did it just now, but what would you say is
Oh,
the
yeah.
game changer here? What would you say is the game changer? Is the game changer, fully understanding and knowing about you equals you, or is you've already done that one, so I'm going to ask you for a different game.
Yeah, I think probably one of the most important considerations with HIV treatment is adherence. And so, we talked about lots of different ways to improve adherence, think about adherence, including injectables, including streamlined regimens that are, one pill, easy to take. But also thinking about the person's particular barriers and any challenges they might have. So I would say adherence for so many reasons is important. And then also, again, with these interactions and the concern about interactions with over-the-counter products and vitamins and supplements, I would say that's just, again, reinforcing that point of good communication and encouraging the patient to come with you with any questions about what they might be taking over the counter.
Yep. So as is the case with so many of our conversations on the podcast, the game changer is that pharmacists have a very impactful role in managing patients with HIV. So yeah, so many things that we are the experts at doing and can really improve the quality of life and outcomes for our patients with HIV. So thank you again, Rachel. So good to have you again. We really appreciate you giving us your time again.
Thank you so much for having me. It was great to be here.
So before we wrap up, here's a quick tip. Through our partnership with Pyrls, you now have access to the clinical charts and practice tools that we talked about and that I shared during this episode. The resources are designed to enhance your workflow and support patient care. You'll find all the links and details in the show notes, so be sure to check those out. If you're a CE Plan subscriber, be sure to claim your CE credit for this episode of Game Changers by logging in at CEimpact.com. And as always, have a great week and keep learning. I can't wait to dig into another game-changing topic with you all next week.